Hello, my name is Dr. Barbara Rodwin, and I'm here at the Back to Health Wellness Center, and we're actually going to talk today about the active release technique. Do you have sore, tired, aching muscles and joints? Have you suffered from a fall or an injury that hasn't recovered fully? The truth is, at some point in our lives, we have all had times where the constant aches and pains can get us down. However, there is a solution to relieving this tension and restoring movement for long-term gain, and that is the active release technique. Many of Back to Health Wellness Center's practitioners are certified in this. The active release technique is a new and highly successful hands-on treatment method to address problems in the soft tissues of the body, including the muscles, the tendons, the ligaments, the fascia, the joints, the capsules, and even nerves. What makes active release technique different from other treatments is that it is designed to identify and address injured, imbalanced, inflexible tissue and adhesions or scar tissue that are interfering with the normal function of the body. We are now going to look at how the active release technique works. I have two pieces of tubing here, one with knots in it and the other one without. What we've done is cut these two pieces of tubing to the same length, and then we've tied 4 knots within the one. And you can see from that the one with the knots is actually shorter than the one without. So what happens when knots, adhesions, or scar tissue develop in different types of tissues, they do shorten and tighten and tense. So with the active release technique, how we actually work on things is we actually take the tissue that has adhesions, we'll shorten it into its shortened position, and then as we take it through its stretch motion, because every tissue in your body has its own movement, so as we take it through its stretch motion and stretch it out, we'll make a pass over the knot. So we'll be actively releasing these knots, and over time we can actually help make them smaller and smaller. So think of them as maybe being a big boulder initially, and then eventually they could be a small grain of sand. We call that passing over the knot, the adhesion or the scar tissue, but a patient often calls it rubbing the area.
Hi everyone, my name is Ashley Rochlow and I'm a registered massage therapist here at Back to Health Wellness Center. So without proper maintenance of our tissues, and by maintenance I mean you would go into the dentist every 6 months to get your teeth checked, to get your teeth cleaned. For our muscles and for our body, usually it's within a month's time, if not more, depending on which areas are being treated and what exactly is going on in the muscle. If it's something more chronic, then usually as therapists or practitioners, we would like to see our patients more often just to nip that problem right then and there and help to get that speedy recovery happening. So a little bit more about scar tissue. So the reason why scar tissue needs to be maintained is because it can become a problem over time. So scar tissue is very much like plaque. If we let plaque build up on our teeth, this can then cause cavities to form. Cavities can then cause pain, and then that pain can lead to further problems and health issues. So it's very much the same as in muscles. If scar tissue is allowed to build up a little bit more so than our natural body does, then what can happen is that can prevent movement, and then once movement is prevented, it can cause problems further down the line. So a good example posturally, say for instance, I want to move my arm, and the normal range of our arm is say all the way up this way. What can happen is if we have scar tissue, we might then, limit it here. So then the first thing we're going to do is we're going to lift our shoulder to accentuate that movement rather than the arm itself. And then scar tissue will then start to build in the neck. So this is why it's really important to have proper maintenance with active release technique, massage, and all the other things like stretching and good health remedies and self-care at home. So a common condition, one that I can think of very personally, with especially in adjunction to muscle weakness, muscle strain, overuse. I personally am a violinist. I love playing violin. And so by holding the violin, I'm more or less like this constantly. And by being in this position constantly, what happens is, again, I'm using my muscles like this all the time. So when I build scar tissue, a lot of the time it's in my forearms and in my neck. And the one way that I really notice that I get the muscle weakness, I get different types of just feeling stretch, is especially in the arm that actually plays on the notes or on the actual board of the violin. So I notice that active release really helps me to try and keep my hand nice and limber, to keep it nice and stretched, so that when I do go to play my violin, I'm able to keep up with the music that I'm playing. So it's really helpful.
Hi, I'm Andrew. I'm one of the massage therapists here at Back to Health. So, to answer the question, what is active release? The short answer is, it's a kind of massage. It's a way of treating soft tissues in the body, muscles, tendons, and ligaments. But, unlike a conventional Swedish massage where you might be lying on the table and the therapist would use a moving contact, with active release, therapist contact is fixed, and we get you to move instead. Because the contact is fixed, we can work over clothing, so generally you don't need to get undressed, and therefore we wouldn't need to use draping and pillowing and things like that. And because of that, the treatments can be a little quicker. And because the treatment is more focused, the number of treatments tend to be fewer. That, in a nutshell, is what active release is. So, active release techniques gives us an elaborate system of protocols or methods for treating soft tissues, muscles, tendons, ligaments. Carpal tunnel syndrome is the experience of weakness in the hands and grip strength, or burning pain or numbness or tingling in the palm of the hand into the fingers. It can also be burning pain in the front of the wrist. It can also be an experience of numbness and tingling and weakness in the forearm. What active release techniques offers us is a list of literally dozens of different soft tissues that can contribute to this problem. And systematically, we can go through that list when we're trying to not only treat the problem, but initially we need to assess the problem. That's actually key to solving anything. ART allows us to treat, but also to understand what's going on as quickly as possible so that you can get a resolution to the symptoms as quickly as possible. So if you're an athlete and you've lost the ability to grip your racket, to grip the barbell, to grip your hockey stick, if you're not an athlete, if you work at a desk, your ability to hold a pen, your ability to use your phone, to grasp a steering wheel, to use a tool, active release enables us to understand the soft tissues that are at play, to identify them and to treat them as quickly as possible.
Hi, I'm Jessica Neptune, and I'm one of the registered massage therapists at Back to Health Wellness Center. With active release techniques, the practitioner will first shorten the muscle, tendon, ligament, nerve, or joint capsule, and then apply a very specific tension with their hands as you actively stretch and lengthen the tissue. As the tissue lengthens, the practitioner is able to assess the texture and tension of the tissue to determine if the tissue is healthy or contains scar tissue, adhesions that need further treatment. When scar tissue or the adhesions are felt, the amount of direction tension can be modified to treat the problematic area. So the active release provider passes over the knot, the adhesion scar tissue, and does not press directly into it. Active release techniques can be tender or sore at times, but this is usually because of the realignment of the scar tissue. Patients have told me it feels like a good hurt or like someone's removing a thorn. It should never hurt to the point of unbearable pain. Your doctor or therapist will consult you before the treatment and during the techniques to help find the right level of comfort for you. An example of something that active release techniques can be used for is something personal to me that I've experienced in the past, with shin splints, which is pain in the interior front part of your leg. As a runner in the past, I would get shin splints very severely. And once I found out about active release techniques, I found out that that was something that could be cured with it. Active release will help to break down the scar tissue that's created in the area surrounding the lower part of your leg. And the great part with active release techniques is that, as opposed to massage therapy, it's a more quicker way of breaking down the scar tissue. When I had my shin splints, I wasn't able to do even long, fast walks, actually even short walks. So with my treatments, after about 3 sessions, I was able to walk distances that I wasn't able to before. And with continuing stretching and active release techniques, I'm able to do the activities that I enjoy doing.
Hi, my name is Erin. I've been coming to the Back to Health Wellness Clinic for about 4 years and been doing ART consistently for about 2, I think. I started doing ART because I was having issues with my feet, of all things, and then started doing CrossFit and realized that ART is also a good benefit for me there, and it's helped me to continue with my CrossFitting and just live a better life in general and just have a better range of motion.
My name is Candace Anderson, and I've been coming to see Dr. Rodwin and Andrew for ART massage for about, I'd say, maybe 8 years now. I've had a lot of really great results in coming here, and with ART specifically, a wide range of sport-related injuries from glute strain, hamstring strains, to plantar fasciitis and other injuries. And I found that the ART technique is probably the most successful technique there is for treating those injuries. And also I've found it very effective as a preventative measure for helping soreness related to the various sports that I do, like running and biking and triathlon, and it's been very effective for me in getting me back up and doing what I need to do.
So we're going to be working on some of Ashley's forearm and hand musculature. As a massage therapist and as a violinist, it's very easy for Ashley and people like me to experience problems due to repetitive stress of the work and the activities that we do. So Ashley, we're going to start with the finger flexors. Can I get you to make a fist for me?
Sure.
Any tenderness there?
A little bit, but no pain.
Okay.
Yeah.
So let's do this. I'm going to reinforce my contact. I want you to open your hand and with your left hand, pull back your right hand.
Okay.
Right there. Okay. And we'll do that again. Nothing too bad there.
No. It's almost like brushing your teeth. Kind of feel good in a way. It's like you're getting the right stuff. Oh, that's a good one.
The brachialis.
Oh yeah, that's a good one. Woohoo! Already feeling better.
We'll leave it there for today.
Sounds good. Woohoo!
Scar tissue is a normal strengthening process of life, but it doesn't have to cause us pain or interfere with our activities. Regular maintenance is important to help keep us limber and ready to take on what life throws at us.